We're pleased to be welcoming you to Gloucestershire Hospitals in the near future for an elective caesarean section to deliver your baby. We have created this short film to support you through this process. We will show you what will happen on the day of your admission to hospital and the steps that you can take after surgery to help you recover and get home as quickly as possible. Before you come into hospital to have your baby, you will be seen by an obstetrician in the antenatal clinic to decide on the timing of the birth. The obstetrician will discuss the risks and benefits of a caesarean section, and you will be given an information leaflet. Some women preparing for a stay in hospital are screened for MRSA at this appointment. A few days before your planned caesarean section, you'll be seen by a midwife in pre-op clinic. You'll have samples of blood taken to check for anaemia and to confirm your blood type. You will be given some tablets with instructions to take before surgery and some chlorhexidine cleaning wipes. We will also give you a My Caesarean form for you to choose which options you would like to include in your delivery. Please do not eat anything after midnight before your caesarean section. You can have 500 ml of a flat isotonic drink such as Lucozade or Powerade, but you should finish this 2 hours before your arrival to the hospital. You can drink still water freely until you arrive at the hospital. Once you're in hospital, you may have sips of water, ideally from your own water bottle. Please follow these instructions carefully to avoid your delivery being delayed. At 10 p.m. the night before surgery and 7 a.m. on the day of surgery, you will need to take the tablets you've been given. On the morning of surgery, have a bath or shower and use the cleaning wipes provided by the hospital. This is to help reduce wound infections. Do not put any creams or lotions on your skin. You may wear a wedding band, but please leave all other jewellery at home. Bring your maternity notes and all your clothes and toiletries for you and your baby. In particular, please make sure you pack a dressing gown and slippers and nappies and hat for your baby. Remember a camera too. When you arrive at hospital in the morning, you will be met by a midwife who will check through your paperwork, measure your blood pressure, heart rate and oxygen levels, and provide you with identity bracelets, a hospital gown and stockings to wear throughout your stay with us. These are designed to improve the blood flow in your legs and reduce your risk of developing clots. Your partner will be given theatre scrubs to wear. It is our policy to repeatedly check key information with you, such as your name, date of birth and allergy status, to reduce the chance of errors being made. So don't worry if everyone seems to be asking you the same questions over and over again. You will meet an anaesthetic doctor who will ask questions about your medical history and discuss the risks and benefits of the different type of anaesthetic available for your delivery. The obstetric doctor will go through the consent form with you and ask you to sign it. They will ensure you're happy with the planned procedure and answer any questions you have. They will be able to tell you your position on the operating list and give you a rough idea about what time your procedure will take place, although unexpected events can sometimes delay things. We will work hard to keep you updated should any changes or delays occur during the day. When it is time for your caesarean section, a member of the theatre team will come to collect you. You should put on your dressing gown and slippers for the short walk to theatre. When you arrive in theatre, the team will introduce themselves and you will sit on the operating table with your partner in a chair nearby. There will be an anaesthetic assistant, theatre scrub nurse and assistant in addition to the medical team. Although the theatre can feel busy, the staff are there to ensure the safety of you and your baby. Your details will be checked again and you'll be asked to confirm the operation you're expecting. The anaesthetist will put a drip in your hand or arm using local anaesthetic to numb the skin first. The drip will be connected to fluid and also to medicine to help keep your blood pressure stable during the anaesthetic. If you are having a spinal anaesthetic, the anaesthetist will need to do a small injection into your back. In order to do this, your position is really important. You will either be asked to sit up or lie on your side. If you're sitting up, you need to put your chin on your chest, relax your shoulders and curl over your bump. If you're lying on your side, we will ask you to bring your knees up to your bump as far as you can. This helps to open up the spaces between the bones in your back so that it is quicker and easier to do the anaesthetic. It is important that you stay very still while the injection is taking place. If you need to move, just warn the anaesthetic doctor first. Some local anaesthetic will be put into the skin in your back, which might sting a bit at first. From then on, you should just feel a sensation of pressure. If you feel anything else, such as shooting pains or tingling, just tell the anaesthetist. Once the anaesthetic is injected, your bottom will start to feel warm, your legs might tingle, and they will start to feel very heavy. You will lie on your side and then on your back with the table tilted to the left to take the weight of the baby off your body. It will feel very strange, but don't worry, you'll be quite safe and supported. Routine monitoring will be attached so we can keep a close eye on you. The anaesthetic doctor will assess how high the numbness extends using an ice cube on your skin. We know that the same nerves that carry cold sensation also carry pain, so if you don't feel cold in an area, you won't feel pain there either. The operation will only begin once the anaesthetic doctor is happy that the anaesthetic is working properly. A catheter will be inserted into your bladder to ensure that it's empty. Your tummy will be cleaned, ready for surgery. You may be aware of the cleaning solution being painted on your skin. A drape will be placed over your body and a big screen will be put up so that you won't be able to see the operation. A final safety check is performed, during which the team will once again confirm your name, the operation you're expecting, and whether you have any allergies. Then the procedure gets underway. Your anaesthetic doctor will be there to keep you updated on the progress of the birth, answer any questions you may have, and reassure you if you feel anxious. You may be aware of the blood pressure cuff on your arm going up and down every minute until your baby is born to check that your blood pressure remains stable. If you feel sick at any point, tell your anaesthetic doctor, as it's often an early sign that your blood pressure has dropped as a result of your anaesthetic. Your anaesthetic doctor can do something to make you feel better. Once it is time for your baby to be delivered, you may feel pressure on your tummy and then your baby will be born. We can drop the drapes if you like at this point so that you can see your baby for the first time. It is not uncommon for newborns to be a little surprised by the speed of a caesarean delivery, so don't be worried if your baby doesn't cry immediately. Unless there's a good reason not to, we aim to delay the clamping of the umbilical cord for 1 minute to allow your baby to receive extra blood from your placenta. Either parent is welcome to cut the cord when the time comes. Your anaesthetic doctor will flatten the bed and give you some medication to help contract your uterus, which can sometimes make you feel a little flushed. So long as the baby is doing well, it will be placed immediately in skin-to-skin contact with you. A hat and warm blankets will be placed over your baby to keep them warm. If we have any concerns, the midwife will take your baby to a resuscitaire. The midwife will do an initial baby check and apply identification bands. Your baby will also be weighed, which is a good opportunity for photographs, have a nappy put on, and then be placed back with you. Skin-to-skin contact with your baby is encouraged as it keeps them warm and helps regulate their breathing. If you find it difficult to hold your baby while lying flat, your partner can support you. The remainder of the operation will take approximately half an hour. Your blood pressure will still be recorded at regular intervals and your heart rate and oxygen monitor will need to stay on. At the end of the operation, the wound is closed with stitches which are usually dissolvable but sometimes have to be removed. A dressing will be applied to your tummy. You will be given clear instructions on how to look after your wound dressing. At the end of the operation, you'll be transferred to a hospital bed, sat up and given your baby to hold again, preferably skin to skin as this promotes early feeding. We will then take you to the recovery room where you'll be closely monitored for the next few hours. The midwife will offer vitamin K for your baby either by injection or by oral drops. No additional visitors are allowed in the theatre recovery. Please explain this to your relatives to avoid disappointment. You will be able to feed your baby however you choose to. Between 2 and 6 hours after your operation, you will go to the post-natal ward. You will be given regular pain relief as the anaesthetic wears off, which are all safe to take whilst breastfeeding. Please tell us if you're experiencing pain, nausea, or any other symptoms so that we can give you any extra medications you might need. The midwives and maternity care assistants on the ward will give you help to get your baby feeding properly. Your baby will have routine health checks from a specially trained midwife or a paediatrician. We expect the numbness in your legs from your anaesthetic to wear off within 3 to 5 hours. Please check that you can fully move your legs again around this time. Research indicates that the earlier you can get up and about and eat and drink, the quicker the recovery time will be for you and the lower the likelihood that complications will develop. You will then be encouraged to sit on the edge of your bed as soon as possible, and it is anticipated that you will be able to care for your baby independently. Your catheter will usually be removed around 12 hours after your baby's birth. A blood test will be performed on you to check for low iron levels, and you may be offered iron tablets if the results are low. The day after your operation, an anaesthetic doctor will aim to visit you to check that you have recovered fully from the anaesthetic and answer any questions you may have. It will be recommended that you stay in hospital until you are well enough to be at home and your baby is doing well. This might be as early as the day after your caesarean, but some will need a couple of nights in hospital. You may be advised to have injections of a medicine to thin your blood to help prevent deep vein thromboses. If this is the case, we will teach you how to do this before you leave hospital. After you go home, your community midwife will visit you and will be able to give you further guidance on your recovery. Thank you for taking the time to watch this video. We hope it has helped you feel better prepared for your caesarean section at Gloucestershire Hospitals, and we look forward to welcoming you on the day of your baby's birth.